So I'm delighted to have with us today. We've got Sue Weaver. Sue, who is a very experienced therapist at the Cancer Support Centre. So Sue, tell me about some of the therapies that you do and how you got into it all.
I actually got into therapies, I think, when I was probably about 8 years old. My 8 years old, my aunt and uncle brought me some crystals back off a holiday, and I was fascinated with them and the energies that each different crystal had, which kind of led me into fascination with plant therapies, which kind of led into other things, touch therapy. And it kind of progressed from there. I've always had a massive interest in aromatherapy, which led into reflexology, which led into Reiki, Indian head massage, crystal therapy, and auricular acupuncture. So I kind of, it's a bit like a rolling stone. I've just gathered that many sort of interests in that field.
So now you mentioned auricular acupuncture, which is quite a popular one at the centre. So tell me a little bit more about that.
Auricular acupuncture is mainly based on the ears, whereas another acupuncturist will work around the whole body. I focus on the ears, where there's over 300 points on each ear. It's specifically used at the centre for helping people pain relief. A lot of older people, particularly men, will dribble. It'll help stop the dribbling. It can help with tinnitus. We've had some good feedback about that. It's relaxing, it's soothing, it can help with migraine headaches. Hot flushes is the really big one though, for men and women, particularly men going through prostate cancer. And obviously with their hormones changing as well, in some cases their flushes can be even worse than for women. But it's been proven that it can help or alleviate flushes completely. So that seems to be one of the main things that people come and see me for, is hot flushes. But again, it helps people quit smoking. It can be used in drug abuse. So there's a list of many things that it can do. But the main ones is usually for hot flushes, and it does help.
And what should a client expect when they come in for a treatment? Because you think needles and pain. So what's it really like?
Okay, well, I do have, it's called Emla cream, and if people are particularly needle phobic, we can put Emla cream on, which kind of numbs the area where we'll be working on. And it's 5 needles that are placed either in or around the ear. It doesn't actually go into your ear, where some people think you actually put needles actually inside the ear. It's not, it's on the surface. They're placed in specific places. You can get a sort of an experience with it, but not an ouch. Mm-hmm. And I think because it's a needle, people are expecting it to be an ouch. It isn't. It's more of a ooh. So it can be a little bit tender, but it's not painful. Once the needles are in, the ears can feel warm, which is good because it shows me that we've hit the nerve and that it's all working as it should do. The needles can be in anywhere between 10 and 45 minutes, depending on what we're working on. In some cases, I will actually move the needle, so people get needles being taken out and another needle replaced somewhere else within the ear, depending on what we're looking to do. Most people who've had it done don't think it is half as bad as they're expecting it to be. And people do come back and they do ask to have repeat sessions with me, so it can't be that bad. I'm usually so busy talking, they don't notice I've put the needles in.
So you distract them?
I distract, yeah. A lot of distracting, yeah.
That sounds like a good plan. And do people tend to have more than one treatment, or can sometimes one treatment is enough?
Well, every individual's very, very different. Mm-hmm. So with some people, yes, it would only be one, or it could be up to 6 treatments. And if you've got somebody particularly that is severely needle phobic, we can use seeds. So it's like little plasters with a little seed in. We just pop those over where I would put needles. So there's a way around it all as well. So, you know, we play it by ear, how somebody is feeling on that particular day. The week before, they may have coped very well with needles. That week, they may not. So it's a way of tweaking. I've also got, it's like an electrical impulse.
Mm-hmm.
So again, if you're not keen on the little seeds, not keen on the needles, there's another way of doing it where you use an electric impulse. It's not painful at all. I tend to feel it more than the client.
Oh.
So there's ways around it. There's a lot of ways around it, but each way is very effective.
Mm-hmm. So why should a client choose to have auricular acupuncture over some of the other lovely therapies that you offer, never mind other people? Why would you recommend it?
I think if a lot of people maybe want a quick fix,
Mm-hmm.
auricular acupuncture can offer a quick fix. And I think sometimes there's more of a sensation there. Whereas you've given an aromatherapy massage, it's very soothing, it's relaxing, you're moving, gently moving connective tissue, muscles and everything, so it's soothing and relaxing.
Mm-hmm.
Whereas I think with acupuncture, because there's slightly more touch and feel to it, I think some clients think they've actually had a better treatment. In reality, no, they haven't. I would say they're all on a par with each other, but every person's experience is very different.
Excellent. Is there anything else that our clients need to know about auricular acupuncture?
It's all done on an aseptic level, so full PPE, everything is aseptic. Questions are asked, you know, they're allergic to any metals, are they allergic to steri wipes? So it's geared around that person. Everything is geared around the individual. One, to make them feel very comfortable. Two, giving them the options of different ways of being able to do the acupuncture, which is important. And I also think it's very important that clients make their own choices, because I think when they're on the cancer path, they're going from a doctor to a nurse to a phlebotomist, then getting referrals to hospital. And in a way, their decision making is almost taken away from them.
Yeah.
Whereas I think at the centre, patients are given options, they make their own choice. So you're giving them back freedom of their own choice without somebody saying, well, you need to have, 5 sessions of chemotherapy or something. It's, well, what would you like? How do you want this done?
Oh, that's brilliant.
It's freedom of choice.
Love it. That sounds excellent. Well, thank you for explaining a little bit more about it, and hopefully it will encourage more clients to take up auricular acupuncture in the future.
I hope so.